Well, hello. We have today a special guest with us in our expert interview series, Dr. Rick Letts of the Pain Management Center of Irvine in Irvine, California. Rick, really appreciate your investment of time today and look forward to diving deep with you and learning as much as we can about your practice.
Well, I appreciate the opportunity, Doug.
Absolutely. So if you don't mind, share a little bit about your business, your background, how long you've been in business, and what it is that you actually do.
Well, it's a long story. I've been at this for a long time. I basically moved to Irvine in the early 70s and finished high school there, and then ended up getting my undergraduate degree at UC Irvine in biology, always having aspirations to do something in medicine. I actually almost went to dental school and became a specialist in sports medicine with dental work, but decided that chiropractic had a little bit more of a broader approach to the entire body. So I ended up getting my degree from Los Angeles College of Chiropractic from in Los Angeles, and then started my practice literally in Irvine because that's where I was from. It made sense. And I started that practice in 1985 with my partner at the time, with Dan Sigler. And we had a fabulous practice. Things were really doing well. And we specialize in sports medicine and mainly just a good chiropractic type office. And years went by, and obviously insurance companies changed and the whole environment became different. And I started feeling that we needed to do something a little bit more integrative. So about 5 years ago, I became a medical corporation named Pain Management Center of Irvine, and we integrated the entire practice. So I have a partner, his name is Dr. Adam Weissman. He's a trauma specialist, and he heads up as our medical director. We have a nurse practitioner, Cheryl Stanton, and we have a physician assistant. Her name is Amelia Narcisito. Sorry, I have a lot of people that work for me. I apologize. And then we have Dr. Song, our acupuncturist. We have two amazing massage therapists. So we try to integrate the practice, but basically, Doug, on a wellness platform. We don't believe in prescribing any scheduled medication. We try to avoid any types of surgeries that are very unnecessary. And we manage pain, like I said, on a very much of a strong, thorough wellness type platform. And it's been really, really effective, very efficacious. And we've expanded into other types of procedures in our office that have really set us above and beyond most practices that perform integrative services. We brought in the stem cell program, our PRP program, and now we have an in-house pharmaceutical program that's just unbelievable for pain patches and such. But we're really, really trying to expand and bringing in really strong, effective therapies to keep patients away from the addictive medications that are so well known now in our media, as far as the opioids and the opioid problem that's just completely out of control. Our office literally sets itself aside from following that, that trap, and we refuse to do so. We want to keep our patients healthy on a wellness program that makes sense. We approach their diets. We have an amazing medical weight loss program that is extremely effective. In fact, I'm a guinea pig. I lost over 75 pounds on it myself.
Wow.
So it's a great practice. I'm very, very proud of it. I'm very proud of our goals and our medical model. I'm also extremely proud of the people that work for me. They're amazing. I'm very blessed.
No, that's great. What I love is seeing people like you doing more and more of the integrative approach, and some of these people that are truly leading this way in our society to give access to more holistic and alternative forms of medicine to prevent the need to take the opioids in this crisis that we have in our country that our traditional models oftentimes subscribe to for whatever reason. And it's amazing. I recently gave a talk a couple months ago and spoke into and discovered that from the 1930s to the 1960s, doctors actually prescribed and recommended cigarettes to their patients, thinking that that would actually help them with their health. And it wasn't that they were attempting to do harm; they just weren't aware of the negative impact. And today, we can replace cigarettes and put opioids in there, which are much more dangerous, actually, much more addictive and lethal. And it's just something that's happening, but people aren't aware of it. So I honor you and people like yourself that are leading this way to introduce alternative forms of medicine so we can prevent these terrible situations that are happening in our world, and give people more holistic approaches that can lead to a greater state of health.
I really appreciate your recognition on that. I'll tell you, Doug, one of the saddest things, one of the biggest travesties I've ever had to encounter was calling a young athlete's parents to my office and having to have them understand that their son was addicted to the opiates that were given to him by the team doctor. It was simply a quick fix scenario. His addiction was so bad that it basically ended his football career. But the parents were so thankful that I recognized the problem because they weren't around him as much because he was living away from home. And we basically saved that boy's life. So wow. And that's just one example of so many that we've seen. And I really demand that the medical platform with opiates changes. The government needs to get involved more and really change the platform, because we prove it on a daily basis. You really do not need to go into that direction. Yeah. If you follow the guidelines that we provide for you, the commitment that our team gives you, the support that we give you, you can avoid doing something like that and follow a wellness platform that'll get you just as well. Maybe it'll take a little longer, but it'll get you better, faster, and healthier. Yeah, that's great. So, and I definitely agree with you 100% on that. So I'm curious, as we transition to, get into a number of different modalities, like you had mentioned, there's stem cell, there's acupuncture that you do in your practice. You have been utilizing whole body vibration, and I'm curious how you first heard about that, and then why you landed on Hypervibe and what your experiences have been thus far in your clinic with that. Well, I've never told you the story, and I'm gonna evolve it now so you really get an understanding. In the late 90s into the early 2000s, I traveled with the NFL, and I got exposed to some of the best training programs in the world. I mean, second to none trainers, gifted physicians, coaches that were, obviously professional coaches that really gave their complete commitment to their players. And I got exposed to vibration therapy early on by those professional teams. And I started really observing the benefit to the players who were subjected to a multiplicity of different injuries using that platform, that instrument, and getting great results. And so later, as we became more integrated in my practice, it became so evident to me that had to be part of my rehabilitation room, where we'd take our patients and our athletes and have them begin their rehabilitation program. And the Hypervibe became literally one of the strongest components or instrument in that room. And I'll tell you, Doug, I could probably put 5 or 6 more in there and still keep them busy almost around the clock. It's wow. So popular. Patients initially are a little apprehensive. Mm-hmm. They feel that, well, they've read in the media that there's all these concerns, and once we bring them into an introductory platform, and then they start graduating and create a cadence of confidence, mm-hmm. and then they start using or utilizing the entire benefit of that product or that machine, it's profound. The results we've seen with this is unbelievable. I'd recommend it to any physician that has any interest in rehabilitation. It's amazing.
Wow. Well, I appreciate you sharing that, and also speaking into the common myth that people have about whole body vibration and some of the challenges or dangers that there are with that. And unfortunately, oftentimes it's confused with occupational whole body vibration, right? Where working with a jackhammer or on a big piece of Caterpillar equipment all day for extended periods of time in an uncompromising or unhealthy physiological position, if they're sitting in a chair with a poor posture and they're being exposed to that type of vibration, that certainly has a lot of danger potential to it as well, and a lot of harm that can be done. Whereas therapeutic whole body vibration in a controlled setting with equipment like this, with the right type of equipment, I would also add, being that pivotal platform instead of the linear platform. I know NASA did a research study around that where they showed that the linear platform, where the entire platform goes up and down, there's some of those platforms out there, has up to 190% more head vibration than the pivotal platform that really mimics the natural movement of human physiology because our hips move independently. So, in that controlled setting with that pivotal platform, there's tremendous results that are being experienced and realized for patients and individuals that are young athletes that are wanting to recover from injury, all the way up to I recently had a therapist send me photos of a 94-year-old woman that was on a Hypervibe machine, working with her balance and her strength and being able to have mobility and lack of pain just from utilizing Hypervibe.
Well, I could expand upon that, Doug. Trust me, in my office, I'll tell you technically, very, very few patients that aren't exposed to the Hypervibe based upon its technology. Again, and trust me, I did my research. I didn't just call you guys and say, hey, send me a machine. I am a very research-based individual, and once I understood how your technology was developed, and again, witnessing it in other facilities and seeing the efficacy results, that made me bring it into my office. Again, it just didn't go by the name, okay?
Yeah.
And as far as the broad spectrum of patients and conditions, we can spend hours here together, but I'll give you a synopsis. You're right. We do use it on our young athletes, especially with weight-bearing joints. We find that it increases circulatory benefits, oxygenation of healing tissue, and also it stimulates the broad base of the neuromusculoskeletal system. You get that you get basically the neurology working well with the musculoskeletal system. So everything becomes more imbalanced and it's working in a kind of a, whatever you want to call it. The body just wants to work together better. Follow me? So it gets everything stimulated at once. Yeah. But anyway, again, going back to the broad spectrum of patients, you mentioned our stem cell patients. I'll give you a great example. One of my stem cell patients, prior to her injection, was wheelchair bound. The woman would not even look at me during our consultation. I had to discuss the entire consultation through her husband. She was so depressed and so angry, she wouldn't even give me eye contact and stayed in that wheelchair the whole time of that hour consultation. Once she was medically qualified by my medical staff, she received her injection. Let's just say within about 4 months, she was using no wheelchair. The wheelchair was sold. She was aggressively on the Hypervibe, literally teaching other patients in the room on how to use it.
Wow.
She was literally back to herself. She smiled. She was talkative. We gave her life back. And wow. Again, all based on the fact that the stem cells did their job in rehabilitating and rejuvenating the knee, but also her following our strict protocol as far as post-injection rehabilitation to bring patients back to that confidence that they deserve. People should not be robbed of things like that early in life. Now she plays with her grandchildren. She's hiking with her family. And again, it just really, it hit me in the heart, I'll tell you, to see this woman have a new life back. So wow. And that's one of many examples I could give you as far as how we incorporate the Hypervibe into our protocol with numerous types of services in our office. But I would tell you, Doug, it's probably one of the strongest tools in our toolbox for rehabilitating our weight-bearing stem cell injection patients. It's incredible.
Wow. Well, I've got chills when you shared that story. It's just nothing makes me more excited and happy when I hear stories like that of people's lives being transformed. And certainly there's other components, like in this case with this patient, it was stem cell. And in addition to that, there is that post-treatment protocol. And what can you do to support and increase the likelihood that they're going to not just actually get back to where they can be mobile, but probably better than they have been in multiple years. And having Hypervibe play an integral role in that is just, it's so amazing to hear, and I love it. So, and I understand too, Rick, you've shared stories with me that, with your pain management center that you have in Irvine, not just in Orange County, California, but you have patients flying from around the world for your treatments. Isn't that right?
But humbly so, we've had a woman fly in from London. Her orthopedic surgeon found out about our services and our stem cell program and interviewed me and decided that she was a great candidate for this particular injection. Flew all the way from London. And a part of the story I may not have evolved with was that after her injection, she only had a very short period of time to stay here in the United States and was required to go back. There was a family issue that she had to go back. But she actually returned, and we were able to expose her to the post-injection rehab program that was necessary for her. And to this day, I stay in contact with her by email and by Facebook. And she's active and pretty much pain-free and enjoying a normal life. In fact, I think either one of her family members is getting married, and I think she'll be coming back to the United States for that wedding, and we'll be able to see her again and touch base with her and see her progress. So yes, you're right, Doug. We do get patients from literally, I mean, every day is an exciting day because we don't know how patients are being referred to us.
Yeah, that's incredible. And I understand for you, the non-negotiable really is that post-treatment protocol, because if they're not doing that, the likelihood of them having that full recovery and experiencing the mobility and the lack of pain or whatever that outcome is, the desired outcome, the odds of that happening are decreased tremendously without having that post-treatment protocol, and you're utilizing Hypervibe as part of that.
Well, I think that there are probably two camps of thought. The one is the physician office that will deliver the stem cell injection or the PRP protocol and just let the patient progress naturally on their own and hope for the best. We try to take chance out of the equation. With my background in sports medicine, I want to make sure that the patient understands the commitment to becoming a stem cell patient. They have to follow the post-injection rehabilitation program, which is usually a little over a month to 2 months, depending on the patient's recovery, so that we can ensure that we're improving circulation, we're watching their behavior as far as dietary choices and such, and we can expose them to, again, devices like the Hypervibe that we can make sure that they're strengthening the muscles that are been weak over time. Remember, we're treating with a stem cell an aggressively degenerated joint. So can you imagine the surrounding soft tissue of that joint? It's became atrophied, it's weak, it's lazy, there's no ligamental integrity, the circulation is poor. All these things need to be rehabilitated in addition to the stem cell injection. The stem cells will do their job. They'll rehabilitate the joint and they'll rejuvenate the tissue in that area. But as far as the post-injection rehabilitation program, that's going to aggressively bring the strength back to that joint and the confidence. We don't want patients to get an injection, not have the stability, fall and break something else. Follow me? That's terrible. We want someone who followed the entire program, and we're very insistent upon it. Patients that are not cooperative, they're highly warned. Trust me, we make sure that they know that this is a team effort.
Yeah. Well, I've found that to be true when I study some of the best people in the world and the best medical experts in the world, like yourself, that are doing different types of modalities. That it's not just the treatment or the procedure; it's what you do afterwards that dictates whether you're going to have that recovery and go back to a normal life or not. I had a spine surgery with Dr. Robert Watkins up in Marina del Rey. You might know that name. He's one of the top spine surgeons in the world, and his post-surgery protocol was a vital component of that, and I utilized the Hypervibe as part of that. And I had a lot of nerve damage on my S1 nerve, and therefore the muscles weren't firing, and they just weren't communicating with the brain to be able to be activated. And having that Hypervibe as one of the things that I use for myself was an integral part of me being able to get mobility and movement back. And you see that with people like him as an example. I think it's around 88 or 89% of professional athletes return to their sport after having the surgery. And it's not just the procedure. The procedure is the procedure. It's what you do after that. And having the care and guidance of an expert like yourself, where patients are compliant and they're following through with that, that's the real secret sauce from my understanding.
I couldn't agree with you more. Seriously.
Yeah.
Again, and I'll give another example. Besides the stem cell patients, I mentioned earlier on that we have a weight loss program that's medically guided.
Mm-hmm.
You know, it's a very sound, safe program. It's based on an alkaline, orientation. We make sure that patients minimize their carbohydrate intake and sugar intake, increase their hydration, and obviously increase their protein intake, and do it more of a lifestyle than a diet.
Right.
We want to make sure we're changing their whole frame of mind as far as how they encounter their eating habits throughout their day. But now think about this: with our having the Hypervibe, that stimulation of the adipose tissue, putting them through the rigorous programs that the Hypervibe allows them to go through based on age and tolerance, it accelerates metabolism of adipose. And what a wonderful opportunity for us. And here's the best part. I've yet to meet a weight loss patient that doesn't remind us that they have to do the Hypervibe before they leave their appointment. It's amazing.
Yeah.
You know, after they meet the medical staff and check in and have their measurements and have their little brief consultation, they adamantly have to go in there and do their Hypervibe for their 20-minute allowance or 30-minute allowance, because they're so enthralled with the response it's giving them. So pretty exciting.
We loosely use the term and the phrase "a shortcut to a better body" at Hypervibe, and it's not that we believe in you must take shortcuts or you should be taking that instead of doing the other things that are so important to be able to achieve the desired outcomes and the better body that people are looking for. Although one of the most challenging things, whether it's someone who really has been struggling with weight loss or having a habit of not exercising, as we know, habits are really hard to break because we get those neural pathways in the brain that get so hardwired. And that also applies to people that are exercising regularly and eating healthy. That's hard for them to switch that habit to a more negative habit. Although when we have those people that, it's challenging for them, they've never developed those positive habits of exercise. The great thing about Hypervibe is in just a few minutes a day, because of that massive stimulation and what it actually does to your body, in 5 to 10 minutes, really, if that's all someone had, to go stand on this machine, and then it gets you moving, because it kind of does the work for you in a lot of ways. Now, certainly there's different positions and postures, but it's like having a workout partner that if you show up to the party, so to speak, it's going to meet you there, and it's going to initiate that movement for you on your behalf. And that makes it a lot easier than going out on a trail and running on your own. And again, that doesn't mean that people shouldn't do that. We love people doing all kinds of different exercise. It's just a great bridge for people, and especially people that have minimal time to have that stimulation and to be able to initiate that movement in a positive direction, to get their body moving, to get their metabolism moving, the circulation, and then also the lymphatic system, the relationship with that.
Yeah, we take this to the nth degree. I have 2 pro golfers that are rehabilitating thoracic spine injuries. Golf it has its negative effect on the spine. It's a demanding swing, and it can cause thoracolumbar or even thoracocervical injuries and conditions. And both of these golfers had thoracolumbar conditions that we were rehabilitating. Both were very familiar with vibratory plate technology because of whatever exposure they had throughout their professional career. And we brought that in with their, again, we coordinated their Hypervibe with their other treatments, being, like acupuncture, massage therapy, physical therapy, the chiropractic, even trigger point injections were included with their protocols. And bringing the Hypervibe, again, I saw an accelerated response because it stimulated the entire body and allowed the body to kind of find an equilibrium and kind of almost compensate from the injuries and disperse that muscle stimulation so they had more confidence. A lot of them both of them actually went back to the tour pretty quickly.
Wow.
So I was pretty impressed. Having that tool in the tool chest is just giving me that much more added advantage over what I used to not when I didn't have it, right? And now seeing the difference, I wish I knew this 36 years ago. Trust me.
Yeah. Wow,
You know,
that's amazing.
what a change I could have made.
Yeah, yeah, absolutely. Well, I appreciate you speaking into golf because it is such a popular sport. There's so many people in the United States and around the world that love that as a passion, and a couple different things. We actually have a couple professional golfers that actually have the Hypervibe on their tour bus for that very purpose, pre and post round. It helps to activate and get the muscles activated before you go out, which as you know, helps to prevent injury and sore muscles, and then also post round treatment just to loosen everything up, clear the lactic acid out, and it just helps your body recover a lot quicker by having that. And a lot of people are doing that, but then there's also the elderly population, because one of the things about golf, you can do it for a long time as long as you remain healthy. And when you can add years of quality of life back to people as they become older, when their body starts to naturally break down, to be able to help change that trajectory by utilizing Hypervibe whole body vibration, it does add those years of quality of life back. And I know for some of the people that we've communicated with, when you're talking about an extra 2, 3, 5 years of life and quality that you can add to someone, I mean, that's significant.
You would, something that we're not really prepared for as a society is that as people in this generation are taking better care of themselves dietarily and obviously being more and more active, we're having a longer lifestyle. People are living longer.
Yeah.
And it's because of these tools and these programs and the wellness approach. People are really kicking in with this, and they're enjoying, like, again, going back to the woman in the wheelchair, she's enjoying a whole new level of lifestyle that she thought she lost.
Yeah.
And now she's back in the game and enjoying every day.
Yeah.
And what a change for her mental aspect is her whole outlook towards life. It's so much more positive.
Yeah.
So very fascinating.
Yeah, it is. So I'm curious, we've got stem cell, we've got elderly patients as this example. You mentioned golfers and weight loss patients. What are some other examples? If you can think of another example of some of your patients or people that you've seen that have utilized Hypervibe with success.
Well, I think in general, and again, I don't want to or come across that we have the best program in the world, but our program is very sound. And what we try to, and I want to reiterate that information in this way, what we do with every patient is to engage them with the entire integration. So whether they're coming in from an auto accident, for example, and it's a severe whiplash, sometime within their recovery, they're placed into the rehabilitation room and exposed to our Hypervibe and other types of technologies that are in there. So that allows them to accelerate and also have higher levels of stabilization from trauma. We deal with a lot of work injuries, patients that have a lot of lower back lifting injuries. Irvine has a broad spectrum of different types of industries, and we see everything from computer neck to lower back injuries, disc injuries, where people lifted something too heavy at work and have to go on work comp. And then I hate to say this, but you just have the weekend warrior, the patient that overdoes it. We just dealt with a tennis player the other day. He's playing tennis 7 days a week, and he's so obsessed with the game. He loves it so much. We had to kind of sit him down and put him into our program and have him understand that a little less is going to be better for him, and that we're going to rehabilitate his hip injury, slowly. And again, we will use the Hypervibe with him also. Right. So I just want to make sure that you thoroughly understand that we don't have you come in and one visit and you're out the door.
Right.
It just that you cannot rehabilitate an injury that way.
Yeah.
And the old school way of just focusing on one type of discipline for that patient is gone. That type of approach is history.
Yeah.
You have to look at the integrated model. And that's where patients I know are seeking more of. Our office and our office patient population is that type of patient. They've tried the singular, isolated practitioner who only knows one approach and have failed.
Yep.
Now they want to seek a practitioner office like mine that's integrated with multiple minds, numerous physicians looking at them and saying, okay, you need this, 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 and this. over this period of time, and this is how you're going to rehabilitate this condition the proper way. So that's the overall philosophy and patient demographic that we're starting to see grow and grow and grow over the years that we've become integrated. People want more, and they want it on a wellness platform.
Yeah, I couldn't agree with you more, and I appreciate you speaking into that, because that's something I'm incredibly passionate about as well. And again, not just Hypervibe. There's so many different modalities and approaches to be able to approach creating greater quality of life for people, no matter what their condition or what their starting point is. And the old days of there being one modality is becoming a trend of the past. So, in addition to speaking to, potential clients or patients that may be watching this, there's also the healthcare practitioner that's out there that must evolve their practice. Because the one thing that I know to be true is there's more and more people like yourself utilizing an integrative approach, and you're capturing greater levels of market share because of that integrative approach and the results, most importantly, the results that you're experiencing from your patients. And I'm sure you're like many other integrative centers out there, that one of your primary ways that you grow your practice is by word of mouth and referrals from happy patients. And that word travels. Just like you said, you've got someone flying in from London to have treatment from you because of what they're hearing about the results that you're accomplishing with your patients.
Yeah, again, I'll give you another prime example, and I hate to keep cycling back to stem cell, but it's one of my biggest passions right now. Yeah. One of the problems we saw early on in the program were patients were so brainwashed that they had to have knee replacement or hip replacement or shoulder replacement by their orthopedic surgeons. And that was the end-all approach. No matter what, my doctor said I need to have my hip replaced. I need to lose my knee. You got to cut off my hip. Mm-hmm. Now, what are we seeing now with the statistical nature of the success rates with stem cells? I mean, more and more patients are saying, why do I want to lose my natural tissue when I have the opportunity to rejuvenate what I have? And I could keep my natural knee, I can keep my natural hip, I can keep my shoulder, and have the injection rehabilitated the proper way, and have far less difficulty in recovery, far less exposure to danger. Yeah. We had a patient that ended up with MRSA with a knee replacement. It was so bad they almost had to amputate her leg. Yep. Those dangers are not a part of stem cell therapy.
Right.
If a patient is properly qualified for stem cell injection, we've yet to have a complication. Yeah. We've never had an injection that caused infection or rejection. It's just, but then again, I am very critical on who I use for our stem cell, providers. So we only deal with the best of the best. So, and our program is the best of the best. We take no shortcuts. Everything's done by the book. And like you've reiterated a few times, we insist on the post-injection rehabilitation program to ensure that recovery. So, yeah, patients are getting wiser. Yeah. They're second guessing their physicians. They're saying, wait, I don't really need to have my knee cut off, do I? Aren't there other opportunities? And, of course, if the doctor knows his science and he knows his research, they'll be able to offer him that information. But more than likely, again, an orthopedist is going to recommend what he does for a living. But I will tell you, in defense of that, we're starting to see an evolution. Mm-hmm. It's starting to happen. Mm-hmm. Stem cells are becoming more and more popular, and more physicians are taking the time. Orthopedics, general surgeons are taking the time to really investigate. In fact, I know a few of my friends who are orthopedic surgeons. They're actually doing surgeries with stem cells. So they'll do the necessary debridement or arthroscopic procedure, and then provide a stem cell injection or PRP program afterwards. And that, again, is starting to really facilitate better and better recovery. So we are seeing a genesis. We're starting to see an evolution where more and more doctors are becoming more and more educated. So I don't want to throw everybody under the bus, but I am seeing a radical change of patients coming in and saying, I don't want to do the surgery. What are my options? And it's a wonderful, wonderful opportunity, trust me.
Yeah, I love that treatments such as stem cell and other innovations, just like whole body vibration, when people are becoming, when something new comes on, at least in the larger level of awareness of our society, there oftentimes is that skepticism, that doubt, that not knowing, and there's those older ways of approaching creating greater quality of life that are so ingrained into people's level of thinking that they're not open to something new. And then there are those trailblazers out there, like what you're doing, and it's stem cell as a whole, and then Hypervibe and some of the earlier technologies when that research came out about whole body vibration. There's a lot of similarities there, and what's great is the more success stories there are, the more people are having positive transformations. It creates this rippling effect where all of a sudden this will become the norm. And one of the conversations I had with someone, they were sharing a story at a conference that they were at recently about whole body vibration, and it was one of the big fitness companies that are selling to the big health club chains, and they believe that over the next 5 to 10 years that the whole body vibration machine will be the replacement or the equivalent of what today people have as a treadmill in their home. That it'll be that common because of the positive uses. And I could see some parallels with stem cell as well, in that the commonality of like, well, the first thing you think about when you have this challenge is, hey, how will stem cell help with this? Or the first thing you think of when you have a piece of home equipment is, I want to have a Hypervibe in my house because I know that that is going to achieve the greatest return on investment for my quality of life and my ease of either recovery or being able to have the less pain, whatever that might be, or greater levels of muscle activation that people are ultimately looking for to have a greater quality of life.
But Doug, that comes with a lot of responsibility, and I take this extremely serious. Listen, practice is our business, but we're more than that. We're a strong patient advocacy group of people. My professionals always think about the patient's safety, and making the right choices. Follow me? Yeah. And that responsibility is tremendous, not only on my lap, but also on your lap. And our goal in our office is to make sure that we run the most ethical approach to any patient that walks through that office. Yeah. So what that means is that if a patient truly doesn't qualify for a stem cell injection, we tell them that. We tell them you don't qualify. We need to get you to do X, Y, and Z to get qualified and get certain types of conditions under control, like diabetes. Or a patient that comes in over 100 pounds of excess weight on a weight-bearing joint that needs a stem cell injection, that's going to be a tremendous deficit in their regard. So we take this very seriously, and I would almost reflect that back on the corporation of Hypervibe. Yep. The responsibility is to make sure that we're collecting data. We're making sure that we're staying close to the responses that are being seen in the community of people that are utilizing the Hypervibe. I'm willing to provide my office as a research facility for Hypervibe if necessary down the road to collect data. Yeah. Responsibility is just literally, it's on our lap. If we fail as practitioners or individuals involved in the healthcare delivery system and not provide that information to the general healthcare community, then that's our fault. 100%.
I couldn't agree with you more. And and with that, this is just one example of the things that we're doing the best that we can to our ability to create these type of conversations, because a lot of that responsibility, rather than people being siloed in their own corner and attempting to do their own thing, how can we bring people like yourself together and other experts around the world, that whether it's stem cell or whether it's Hypervibe whole body vibration, where people collaborate, they share their stories, they share their best practices, any potential challenges that may exist. So we can, shorten that learning curve, not just for the individual person who's in the silo, but to bring people together so we can identify what these best practices are and keep altering and changing as required to be able to achieve the outcomes that we're looking for with the least challenges possible.
I couldn't agree with you more. Seriously, yeah. I think embracing that responsibility as professionals that we are is it's a tremendous duty to the society and the public society. I'm serious.
And it's something that's missing, quite honestly, and for whatever reason, I think a lot of it is that people, they haven't been provided with a container or a context to be able to have these type of conversations. So it's people like ourselves that are having these dialogues that we can then share it with other people, and hopefully there's going to be a positive ripple effect. And this is something that we're sharing publicly here, and at the same time, we also have private masterminds and dialogues that we're sharing. certainly honored to have you be able to be a part of that. And I appreciate your willingness to be part of research. And that's some of the intentions that we have. We've got an app that we're developing that a lot of what we're going to have behind the scenes is just peer-to-peer with medical professionals to be able to share their best practices or protocols, experiences that they're having, so we can keep sharing that and then collaborating to be able to create a wider ripple effect in people's lives.
Well, one of our meetings when you guys paid me a visit that really made me excited was the ability to create a protocol that I specifically designed.
Yes.
So in other words, have a knee stem cell protocol or a hip stem cell protocol or a shoulder or a whiplash patient or a lumbar disc patient, and being able to customize that protocol. And the best part would be to be able to share that out to the general community so that other physicians don't have to recreate the wheel. Follow me? Yep. Say, listen, this is what's worked best for us. Try it.
Yeah.
And once they try it and they see the efficacy of it, they'll be able to benefit from it. Their patients will do well with it. It's exciting.
Yeah, absolutely. Well, we're really excited about it, Rick. I know this is going to be the first of a number of different conversations, hopefully, that we're going to have discussing, all things integrative health as well as Hypervibe, whole body vibration. And, if you don't mind, and we will have below here a link to your website so people can learn more about you. But beyond that, how can people find out about you and learn about your practice and what you're up to?
Well, not to sound too corny, but this is my passion.
Yeah.
So anybody that wants to reach out to me, hopefully all good, I mean, I know not everybody's going to agree with everything I said, and I'm not expecting that, but the bottom line is I'd love to hear from anybody that has a question or concern, regardless of what we discussed here today, whether it's stem cell or the Hypervibe or how both work together, or any of the other services that we provide. I'd welcome that through an email or anything else that they'd like to contact the office directly through.
Yeah, sounds great. Well, we greatly appreciate your investment of time today, Rick. And again, we're going to have a link below here with some white papers that people could download to learn a little bit more about the technology and how they all work together. And again, we look forward to continuing our dialogue. We're honored to have you part of the Hypervibe extension family that we have, that we're rapidly building with some of the top medical professionals and experts around the world, such as yourself, that are part of Hypervibe. And we look forward to continuing this and providing as much value as we possibly can.
Doug, thanks for the opportunity. And by the way, the honor's all mine. You guys are amazing. And I appreciate what you've done for my practice and for my patients. We're all very appreciative.
All right. I appreciate it. And we'll definitely be in touch. Thank you.
Thank you.